Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Greg Fuqua, who is a family doctor and the newest addition to Family Practice Associates. Welcome.
Good to be here.
Now, in COVID, we all didn't, our routine screenings went away. We didn't do our colonoscopies. We didn't do our mammograms. Well, now COVID's gone away a little bit, and we're starting to get into doing that, but we haven't talked about cholesterol in a while. Why is it that we should still worry about hypercholesterolemia, which is high cholesterol?
Yeah, we need to worry about that because that basically is one of the factors that leads to people developing heart disease, strokes, and basically peripheral vascular disease. And it's the #1 cause of morbidity and mortality in Kentucky.
So are there symptoms you have of cholesterol, or do you have to do a blood test?
Well, generally you have to do a blood test, especially early on. When you get more advanced age and you have more risk factors, eventually you will get symptoms of ischemic limbs, chest pain, TIA symptoms, but early on when you really need to treat, it's pretty much asymptomatic.
Now, you mentioned risk factors. What are some of those?
Well, your risk factors, probably the largest one that we see is diabetes and smoking, basically. Obesity contributes to it, hypertension contributes to it, lack of exercise and activities also contributes to it. There's also taking some medications, people that have basically like transplants or basically immunosuppressant medications and things. Even the treatment of acne sometimes can lead to increased risk of actually hyperlipidemia.
So by the time you have a symptom, heart attack, stroke, it's not too late, but you'd rather treat it before you get to there.
Right. You try to basically delay those things from happening because you improve people's quality of life if you don't suffer the end stage effects of actually having hyperlipidemia.
So give me some numbers. What cholesterol, when should you worry, or does it matter what your risk factors are?
It does matter what your risk factors are. Basically, there's been relatively some newer studies and things that have shown that basically if at one time we just had total cholesterol to look at and stuff as well, and you really looked at total cholesterol less than 200. Now we also can basically fractionate cholesterol, and you can do LDLs and HDLs and triglycerides at this point in time. Most of the studies show that now that if you have a total LDL less than 70, you really can maybe even reverse some atherosclerotic diseases. And that's the ideal area you want to get. If you've had a previous stroke, if you've had a previous heart attack, that's where you want to be at, and especially also if you have diabetes. Now for the other rest of the population, we know that an LDL around 100 basically is also, you don't advance heart disease and things as well. So you like to be 70 and 100 for those people. And then if you're somewhere say LDL between 100 and 135, depends on your other risk factors and things, but you can monitor that and things as well. If you're younger, that's significant. But if you start getting that LDL above 135, then you actually have more risk involved with that and stuff.
So let's say you are there. There's some treatments. Tell us about that.
Well, basically, I think most people will start with statin therapy, but statin therapy has a couple things it really does. It decreases the ability for the cholesterol to be laid down in the plaques in your arteries, and it also keeps those plaques from actually rupturing. So, you have different types of statin medications, and that's one of the first lines. Of course, diet and exercise is also a thing that's really good, getting people to quit smoking. You also have other medications that help bind to cholesterol and you excrete it out. And there's also other medications that may actually help you from making as much LDL cholesterol as well.
Now you mentioned statins. Give us some names. And one of the side effects that I had a lot of my patients complain about is muscle aches. But
right.
Is there a way to avoid that? And does that mean you ought to stop your medicine?
Well, that's interesting. Basically, we do know that certain medications, they're basically your more aggressive treatments, such as Crestor, Lipitor, and things have been known basically to be somewhat of your high dose, and as you increase the dose. And you also then have some of the ones that tend to tolerate it, like Livalo, Pravachol, things as well. And then you have some of your other ones like Zocor that are sort of in the middle, and it runs that gamut of that. The other thing that also is that we do think now is it's somewhat dose dependent. On the higher doses you take, the more symptoms you get from that. We really still don't understand why people get those myalgias or muscle aches they get as the side effect from those statins. What it does know, though, if people basically in most of the studies will show if they reduce the dose or actually they stop it for a while and restart it. There's been some studies that show as much as 85% of people will secondary then tolerate their statins at a lower dose.
And it's important if they can to try to stay on the medicine.
Right, because the thing about statins is that basically statin has a two-effect thing with the body. One, it keeps from laying down those plaques, it keeps from making that LDL cholesterol. But one of the things that a lot of people don't realize is the benefit from also taking it keeps the plaques from rupturing. And so that's a benefit even at lower doses that you don't get if you don't take the medicine.
And I also mentioned, just to reiterate, diet and exercise.
Yeah, diet and exercise is the first thing you always start, especially in younger people. When you get into your 40s and 50s, then you will really lead towards more medication treatment. Younger, it's basically diet, exercise, and lifestyle changes. Don't smoke, basically, So if you have other risk factors as diabetes and other things when you're younger, then you treat more aggressively. But if you don't have that, at first you can always start with diet and exercise.
It's great information. We appreciate you coming in. Thank you so much.
It's a pleasure to be here.
And if you have high cholesterol, you may need a medication. We'll be right back.